Hi, this is Karen Howell. Here is my final presentation for our Music as Therapy class. So the population that I chose to focus on in this presentation is in individuals with schizophrenia. So let me go ahead and tell you why I chose this topic. So I've always been fascinated by schizophrenia. I've worked in the research setting and I've studied all about it in school, but before doing this presentation, I knew nothing about how music therapy is used with this population. Ultimately, this has always been my goal to be able to work in a psychiatric setting, and I was incredibly eager to learn more about how music therapy is used with this disorder in general. So, what I will do in this presentation, I will discuss the definition, the causes, the symptoms, typical treatments, and of course the benefits of how music therapy helps this population. Let's go ahead and begin. So what is schizophrenia? Schizophrenia is a brain disorder that affects how people think, feel, and perceive. What this means is that it is actually a disorder that disrupts how the individual connects with reality. So that's another way that you may hear schizophrenia described, is that it is when an individual may feel some sort of distortion or disconnection and not be able to distinguish what's real and what's imaginary. So it has an entirely complex system of different types of symptoms and is presented in many, many different ways. So let's go ahead and talk more about that. So first of all, schizophrenia is defined in the DSM-5, the Diagnostic and Statistical Manual, 5th edition. So let's talk about the main thing that is different with this edition of the book and the former edition, which is the DSM-4-TR. So formerly in the DSM-4, there were 5 subtypes of schizophrenia, which included paranoid schizophrenia, undifferentiated, disorganized, catatonic, and residual schizophrenia. So why was this eliminated and put together as one giant definition? Well, there has not been an adequate amount of research to show that actually dividing the diagnosis into those subtypes proved to be beneficial in the overall prognosis and treatment of the recovery of the individuals with this disorder. So in the DSM-5, it became more of a syndrome and kind of an overall vast spectrum that included all of the characteristics that were formerly in these subtypes. So the types of symptoms that are included is there must be the following symptoms of delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, or negative symptoms. At least 2 of those symptoms must be present. At least 1 of those symptoms must be the presence of delusions, hallucinations, or disorganized speech, and continue for at least 6 months. Each of these are what we will learn as positive symptoms of schizophrenia. And just as a side note, the reason for the 6-month prognosis, or why it has to be present then, is there actually is another syndrome or disorder entitled schizophreniform disorder, in which that is present before those 6 months, a lot of symptoms that overlap with actual schizophrenia. So let's go ahead and learn more about those types of symptoms. But first, what is the actual root of how schizophrenia formed? So there are a variety of different theories. The most important thing to understand is that the actual origin of schizophrenia is not entirely understood. It is not entirely factually based and completely agreed upon by researchers. There's a couple specific theories that exist out there. So the first one is that it's a neurological imbalance. So what this means is that there are specific neurotransmitters called dopamine and glutamate that have various reactions that researchers believe may play a role in the development of schizophrenia. So schizophrenia is also partially genetic, even though there's not a specific gene that causes the disease. It's a combination of several. So if you look into research studies about schizophrenia and how it is hereditary, you'll find that the percentage of the probability of developing it increases significantly, especially when you have a twin. Also, if you have at least one family member that has been diagnosed with schizophrenia in the past. So that has been proven in many aspects that it is genetics that can play a role. But again, as I said, it is an absolutely complex and not entirely understood disorder. So the types of symptoms that are present. There are 4 types, which is the positive, the negative, the cognitive, and the mood symptoms. So let's discuss those. Positive symptoms. Those include hallucinations, which include all 5 of the senses, which is the auditory, visual, gustatory, olfactory, and kinesthetic. All right, the next is the delusions, which commonly in schizophrenia, there are what you refer to as bizarre and paranoid delusions. So specifically in paranoid delusions, you will also hear them as being referred to as delusions of persecution. And that's the common belief that people are out to get you, or that they're, for example, you may have heard quite a lot of examples talking about how maybe the government is chasing you or how your phones are tapped. Those are some examples of the delusions of persecution. Bizarre delusions are a little bit more similar to very far-fetched ideas that, in I guess the typical mindset, may not make sense. For example, you may hear a type of delusion in which the individual may think that they are God or they are the devil, or for example, those are religious delusions. But the bizarre delusions coincide with those in the fact that there are a billion different forms that you will hear. There's not a specific textbook delusion that you'll hear over and over again. And the last of the positive symptoms is the disorganized speech and behavior. Negative symptoms are the opposite, in which you'll have apathy, blunt affect, incongruous emotional responses, reductions in speech, social withdrawal, impaired attention, anhedonia, sexual problems, lethargy, and catatonia. And in the presence of negative symptoms, first of all, they're a little bit tougher to spot and to diagnose, which is why the treatment is a little bit more problematic and difficult in many situations with the negative symptoms. So in this picture, for example, this is a patient that is in a catatonic state, and in that state, it was formerly one of the branches of the subtypes of schizophrenia, of catatonic schizophrenia, in which the body becomes rigid and will stay that way for extended periods of time. So essentially, positive symptoms, the hallucinations and delusions, are things that you see and perceive that are not actually there, and negative symptoms are the traits that you are missing or are a little bit, they may be diminished compared to a typical mindset and development. The cognitive symptoms, there's a little bit less research on these. The neurocognitive deficits are the deficits in working memory and attention and executive functions. There's also difficulty in understanding nuances and subtleties of interpersonal cues and relationships. Mood symptoms, there's even less research that I was able to find. Patients often may seem cheerful or sad, and that may be difficult to understand for the outside individual. There are many mood symptoms that may be misinterpreted or may overlap with a manic mood disorder such as bipolar, or may just go ahead and coincide with a unipolar syndrome as say, a major depressive episode. Typical treatment approaches include antipsychotic medications that are primarily used to diminish the positive symptoms, psychosocial treatments, in which this includes social training, cognitive behavioral therapy, cognitive remediation, and social cognition training. These two together are the primary two treatment approaches that I was able to find in the majority of the research. Additional psychosocial treatments may include occupational therapy and music therapy, though. So, additionally, the format of the interventions may be individual or group-based. So, how does music therapy play into this? Well, research shows that active and passive music therapies decrease negative symptoms. Music therapy helps alleviate positive symptoms and reduces aggressive behavior. Since music therapy doesn't necessarily depend on the patient's ability to communicate, it works well for patients that have communication deficits. Music therapy improves the mental state and social functioning. It also is more effective when used with standard treatments in order to reduce the severity of negative symptoms, depression, and anxiety. Positive symptoms are not affected by music therapy alone. They do need to be treated additionally with the medications of the antipsychotics. And music therapy should be widely adopted for treatment due to the low cost and lack of side effects. That is the primary point that I found to kind of wrap in this presentation, is it is beneficial, it is cost effective, and it may be an alternative form of treatment that may not be considered by many, but it proves to be incredibly beneficial in helping these individuals live their lives and improve a quality of life overall. Thank you.